Cardiac arrest, it's a medical emergency. It can happen to anyone. So let's find out how you can save a life. So, I am sure you have heard about what happened to the Danish footballer Christian Eriksen during a match of the European Championships. In the 42nd minute of the game, he fell down to the ground and it was later revealed that he had suffered a cardiac arrest. This means that his heart had stopped pumping blood to the major organs in his body. Thanks to the medical staff at the game, Christian Eriksen was revived on the pitch and his life was saved. So in this video, I am going to go over what is cardiac arrest and how you can save a life of a patient who had a cardiac arrest. So what is cardiac arrest? Sudden cardiac arrest can happen to anyone at any time. The heart would stop beating and blood will not be pumped out to the major organs, such as the brain and the kidneys. But what causes sudden cardiac arrest? Firstly, we have to understand how the heart works. The heart has an electrical system. This electrical system controls the rate and the rhythm of the heartbeat. So, if there is a problem with the system, this electrical system, irregularities will occur. These irregularities are called arrhythmias. These arrhythmias can be of two types. They can either cause the heart to beat faster, or they can cause the heart to beat slower. This is called either tachycardia in the case where the heart beats faster, and bradycardia in the case where the heart beats slower. Some of these arrhythmias, such as ventricular fibrillation, can cause the heart to go into sudden cardiac arrest. Here you would see the types of arrhythmias. So what can you do? First things first, you have to make sure that your surroundings are clear and the person is in a safe position. You have to observe these three letters: the airway, the breathing, and the circulation. First, is the patient's airway clear? Are there anything that can block the patient's airway, such as is he choking? Secondly, the second letter is B. Is the patient breathing? Is there any agonal breathing, which is a sign of cardiac arrest?
Gasping or agonal breathing is not true breathing. Do not confuse it with normal breathing. The victim is in cardiac arrest. There may be seizures. The intervals between breaths get increasingly longer. Start CPR immediately as if the person was not breathing.
The final letter is C, circulation. Is the patient losing blood? Are there any signs of hemorrhaging, which is bloodletting? Those are the most important things you have to look at before you do anything. Then what you would do is tell someone to call an ambulance, while you would start CPR, which is cardiopulmonary resuscitation. This is a procedure that will mechanically pump blood to all the other organs.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help.
It is also important to have an automated electrical defibrillator. When a patient is in cardiac arrest, an electrical impulse would help to jumpstart the heart. And this is what an AED would do. It is very important to know how to use an AED, and therefore down in the description below there will be links that you can access to find out more. There are also a number of first aid courses that you may wish to enroll in. Thanks for watching, I am Matthew and see you on another episode of SciSolved.